I'm Dr. Sri Banerjee, core faculty for the College of Health Professions at Walden University. Today I'll be talking about a little bit about rheumatoid arthritis and how that is associated with malignant melanoma. We looked into the National Health and Nutrition Examination Survey to see if there was an association. But before we got started on our research, we were looking into the literature to look for any sort of conditions that are connected to malignant melanoma, and definitely we found that rheumatoid arthritis had links to cancer, so um, we thought there might be a connection. Um, However, what was even more unclear was the fact that if inflammation was the reason that rheumatoid arthritis led to cancer, or was it in fact the treatment like methotrexate that led to cancer? So the verdict in that is still out, but these are the different antibodies in Figure 1 you can look at that are actually targeted in rheumatoid arthritis therapy. So we looked at National Health and Nutrition Examination Survey between the years in 2005 and 2010 and cross-sectionally tried to see if there was some sort of association between rheumatoid arthritis and malignant melanoma. And furthermore, what we did is we tried to see if there was any sort of difference by gender. But before that, we also took a look at another data set, the National Health Interview Survey, and according to that, the prevalence of rheumatoid arthritis was in fact higher among women, and this was all across the board among all races. But we saw some variations in terms of gender and race. So we wanted to take a look a little further and see if gender modified the effect of rheumatoid arthritis on melanoma. So for starters, there was an increased effect that was noted for rheumatoid arthritis and malignant melanoma. So there was an association there. The odds ratio was 2.72. But what was more interesting is that when stratified by gender, males had a significantly higher increased chance of malignant melanoma if they had rheumatoid arthritis than females. So in males, this was 6 times higher chance of malignant melanoma. Why is that so important? Well, number of reasons. One is the fact that it's important to do grouped analyses, to look into populations, subpopulations, stratify by race, and look individually at effects in specific groups. Next, what is so important is that we need to start to target inflammatory biomarkers early on and identify them. And we need to do this according to high risk populations and start surveillance and monitoring. And then future research needs to look at this in a longitudinal way. So I hope some of this information has helped you see the connection between rheumatoid arthritis and malignant melanoma. Thank you for listening.